Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here at Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I have the very great pleasure of welcoming Rishona Haynes Omoyugbo out of New York.
Hello.
Rishona is a registered nurse. She is a care manager. She is an entrepreneur. She owns MadeWhole Care Management Company. And she says it's a holistic company which is focused on evidence-based practice and faith principles. So welcome, Rishona.
Thank you for having me, Dale. I'm so excited. So good to see you.
My absolute pleasure. And yes, it's good to see you. So, Rishona, though, what made you become a nurse?
All right. So actually, I became a nurse. I started with my LPN, the licensed practical nursing in high school. So that was all mom. I did not want to be a nurse, but she is a registered nurse, and so she knew that this would be a great opportunity for me. We were immigrants, and it was just part of her master plan for me to be able to afford higher education after school. And so
Mm-hmm.
I was thrust into it. I qualified for the program, which was great. And I had a great time learning, and I fell in love with the profession as the years went by.
Okay, so you started as very young. You're
Yeah,
in high school. You're becoming an LPN in high school. Um, what was the biggest challenge for you?
yeah. I mean, in general, it wasn't an easy program. There's a lot of learning mixed in with just being a teenager, trying to graduate school, the college race, wanting to qualify for scholarships and grants, etc. And you still want to have a social life. You still have the things that teenagers are going through. Your emotions are all over the place. So it was a challenge to find a balance to stay, you know what, to stay focused. Not to say it wasn't difficult, but I did have a good support system. I was, for my age, I think very principled, and I knew that this was my chance. I needed this. So I really did the best that I could to, as we say, lock in and make sure that it worked. And so
Mm-hmm.
back, it wasn't easy, but thank God I made it.
So this is the thing about nursing, actually. It is not easy. At any stage, it is not easy. It may be rewarding, but it's not easy. So what kind of areas did you work?
I started out in rehab. I worked in a nursing home. It was the same nursing home that my mom first worked at when we migrated. And so it was interesting. I had a good time learning the seniors and the system. Eventually, we also had a rehab as well. So I got into a little bit of the rehab world. After that, I did some post-surgical care at Queens General. And then I went into the world of home care when I moved. I had a big our family who just moved out to Long Island. And so I wanted to
Mm.
give home care a try while in school, kind of like ease the burden. And then after I finished with my associates, I transitioned to Stony Brook Hospital. And that was my last clinical or bedside experience before I transitioned to care management.
Care management. But you said something just now that interested me because I wanted to ask you, what was it like working in the same place where your mother was working? Because I asked that question because I my mother was a teacher and I went to high school where my mother taught. And that presented some
Mm.
challenges for me. So I wanted to know, did that present a challenge for you?
Yeah. Well, I didn't work there when she was specifically there. She had already
Okay.
left, but she had relationships there that was still active. So
Yeah.
in that sense, it was a little challenging because I met nurses that had great rapport with my mom and nurses that didn't quite so love her, which is fine. My mom is a Caribbean woman. She's very unapologetic and bold. So if you didn't like her, you didn't like her. But I made my own impression. So that I wasn't bothered by that, you know?
Okay. Okay. All
That
right.
bold, just that bold. I just did not care.
I get that. I get that. Well, so you did other things. What drew you to care management?
Right. So I really appreciated my experience starting with the senior population and in long-term care. and then working my way to acute care because it allowed me to kind of see the lifespan of a patient. I was able to see how they're supported in the community, what resources are in the community. And then when I got to acute care, I started to see those patients we consider frequent flyers, they kept
Mm-hmm.
back. And I wondered, what are they not getting? What support are they not getting? Why are they frequently here for the same issues over and over again? No matter how much we educate or we're educated as the staff that, we're not going to be reimbursed if these people keep coming back. I mean, that doesn't change their reality. That doesn't
Yeah.
change their barriers, the social determinants of health that are affecting their overall.
Mm-hmm.
And I wanted to really insert myself into that process at some point. I didn't intend to do it so early. It was something I thought later down in life in my career I would be able to be involved in. But we pivoted and I love it, to be honest.
Excellent, excellent, excellent. So I have though a question because you have done acute care, you've done long-term care, you're now into care management, and I want to know if there is anything, what would you like to see change about nursing, if anything at all, whether it's education or culture or what would you like to see change?
I think you and I discussed this before. I really do think it's important that members of staff across the entire spectrum really have a voice to speak to the change that is necessary, right? I do think oftentimes we have people in administration and people who are in politics and making these decisions that are not always consulting with the people at the bedside. And that's not just nursing, that's our certified nurse assistants and our HHAs. That's our people working in the home, our skilled nursing agencies, and even the
Mhm.
Medicaid and Medicare plans. These are individuals who are working with these individuals every single day. And I think it's important that they and their voices are amplified when it comes to making decisions about healthcare. In general, it just feels as though if we do speak up, there's an opportunity for retaliation, loss of the job, loss of reputation. A lot of nurses don't speak up because they're
I know.
concerned about their daily bread. And I think that there really needs to be a safe space for us to speak to the systems that are currently in place.
Yeah, yeah, yeah. And I really think that that is the sort of thing that needs to start. That creation of safety needs to start in nursing school, needs to start when someone gets into the workforce, that they really need to know that there is a space, to be safe. And
Mhm.
all of the things you have to be say are not going to be taken on board. They're not going to be implemented. They're not going to be because you know what,
Right.
particularly as a new nurse, you really don't see the big picture, right? You really can only see what you know. But as you grow, that
Yeah.
should still not be a barrier to you expressing what you see. Because
Yeah.
the flip side of that is that people who have been there for a long time accept stuff as it is and say, well, we've always done it this way, and don't really see that we could have done
Ease.
it the different ways, right?
Yeah.
So that really
Yeah.
shouldn't be a barrier. But
Mhm.
there we go. You know,
I can even
sometimes it is.
Yeah, I can even add another thing that just came to my mind. Someone mentioned the concept of finishing school, which I think is more so residency. Some, facilities offer residencies to new
Mhm.
nurses, etc. But I think residencies should be made available everywhere. I really think it's important because that allows people to get comfortable, not just acclimated to the environment, but to make
Mhm.
sure that the quality of understanding and application, real world application is really
Yeah,
universal for
yeah,
everyone. And we can all
yeah,
kind of start on the same playing field.
yeah. Exactly, exactly. The quality of understanding is, yeah.
Mm-hmm.
So you pivoted to become an entrepreneur. First of all, why did you want to create your own care management company? What was the gap that you see that saw that said, listen, I need to do this my way?
I think you're trying to get me in trouble.
No, no, no.
To be honest, I love being a nurse. I love caring for people. And one of the things that makes us so versatile is the fact that we're able to speak to multiple disciplines and coordinate. I love to be able to do that, speak my mind, but I have just found myself struggling with some of the requirements of certain organizations. I have found that, again, our voices are not really respected in some spaces. And I also believe that everyone doesn't have the best interest in heart for patients. Right now, care management is really booming. A lot of tech companies are creating their own programs for care management, and people who are nowhere near the healthcare industry are coordinating care for people, are giving advice, are advocating. Not to say that there should be that they can't do that, but I think the people who have done it, the people who have the skills, and the people who have the heart for these individuals and are not numbers based and money based should be the ones pioneering in care management. And so I thought, if they're doing it, why can't I do it? Why aren't more nurses doing it? And that I think also I just wanted to highlight, I think one of my biggest issues with healthcare today is the fact that it's a business, right? Not to say we don't love to be paid, but people are frequently putting numbers above patients. Just the simple quantity of beds that you have in a long-term facility, I think that should be regulated. I don't think you should just be able to build a building and have just any amount of beds and then not be able to staff it. And so I think quality is important over quantity. And I think nurses are more than qualified to provide quality care.
Yeah, yeah, yeah. Absolutely, absolutely. More than qualified. Needs to be stressed more than. And I think we need to see that. I think we need to see that. Because for some reason we are tied to the employee mode of life, which, okay, nothing wrong with that, I suppose, but we need to be able to broaden our perspective and put our money where our mouth is, put our
Yeah.
energy and our knowledge and our expertise where
Yes,
our mouth is.
yes, yes, for
Yeah.
sure.
And so kudos to you for doing that.
Thank you. It's a perspective I never thought I would embrace, to be honest. I
Mhm.
remember actually at that first job, a nurse, a friend of mine, was encouraging me to get into business, and I thought, I'm a nurse. What, why would I need a business? And it was 10, 15 years later that I realized that, yeah, we are so, sometimes we can
Yeah.
be so single-minded as nurses to
Yeah.
think this is for us. But then
Yes.
is a reason why I think a lot of us we're afraid to move. We're afraid to try different things. We don't think we're capable of going beyond what we've done for the last X amount of
Yeah.
years.
Yeah.
And so our knowledge is valuable and it's worthy of being used outside of four walls. You know,
Yes. 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 And somehow, I don't know where is that, but somehow we don't seem to understand that our nursing license is actually, I have started calling it a universal license. You can do anything with it. You
wow.
really can do anything with it,
Mhm, mhm.
you know. And those skills that you acquire, that knowledge that you acquire, that expertise and experience is second to none.
Yeah, yeah.
So, having done all this, what advice do you think you want to give someone who wants to be an S?
Make sure you like taking care of people. Make sure you love to serve. Let me not say taking care of people. Make sure you love to serve. Make
Mhm.
sure you love and are compassionate about the needs of others. And I would also say it's something that can be developed, right? You're not married to anything. If you want to give it a try, give it a try. And if you realize it's not for you, be honest about that and find a way that you can pivot where you have a strength. I've
Mhm.
come across nurses, we've gone through programs together and we pass boards and everything, and they're like, yeah, this is not for me. And I think it was brave enough for them to say that and to pivot. Give it a try if you're interested, but know that this is a profession that requires a lot. It asks a lot of you physically, mentally, and emotionally. And you need to be committed to doing that in the best way possible.
So now that you say that also, it brings to mind another question that I used to ask, and I think I've kind of stopped asking it recently, but we're talking about, really having a strong personality, knowing yourself, if you want to become a nurse, understanding that it's difficult, understanding that it's going to require a lot of you and all of that. So, what would you say then, in your view, in one word, would be the core quality of a nurse? What must you have?
Love.
Good one.
You, because it's so funny. You can. You will go to work and work alongside some interesting personalities. Like people who probably don't even want to speak to you. I've worked with nurses that don't
Yes.
even like point teeth to get report. And some you're wondering, why are you here? Why are you a nurse? And then that bell goes off and they walk into the room and they turn into a completely different person. When they're with that patient, they are patient. They are understanding. They are efficient. You know what I'm saying? So
Yes, I know.
you gotta be able to do the work and you gotta have a heart to do it. You don't have to like your coworkers, but you gotta treat those patients well. Yeah, definitely necessary. Yeah.
She said love.
Because why else would we keep coming back? It's not an easy
Yeah.
job.
And that's a good question, actually, because I've been thinking about that and asking that question because, well, maybe not recently, but we've been talking or more openly recently about what our discontent is, right? And I'm saying to myself, well, here is the thing. In 2026, we have so many choices that if you are still with this because you want to be, it's because you want to be. And so there is something in this that is feeding you despite your discontent that you're getting from it and that it is given to you. So somehow we're going to have to come to terms with, being comfortable with it.
Yeah, for sure. For sure.
Yeah. Yeah. The other question that I ask everyone is about self-care because that is something else we're talking about. And that is something from my perspective, that is really very important. And it is important from my perspective because I believe that I know, I know that in my early years as a nurse, no one ever talked about it. It was not anywhere on my radar. Right? And still today, we're not talking about it enough, I think. And many of us are doing lip service, but not really taking care of ourselves. So, what does self-care mean to you? And what do you do for you?
Mhm. Oh man. Self-care, well, that word is such a broad word. I can go in a million different directions. Starting with what I do for myself,
Hmm.
I make sure I have alone time. And my husband and I joke all the time when I tell him, hey, I'm gonna just take a drive. He's like, you're going to the drive-through, aren't you? You're gonna get to I'm like, yeah, and it's not just the drive-through that I love, but it's the alone time. It's the ability to listen to what I want, talk to myself, talk to God, scream, cry, park somewhere, let it all out, process, go through my to-do list. Like I just need time to sit with my emotions and how I'm feeling, and if that means on the way I'm gonna have a small fry, I'm gonna have a small fry, but making time for yourself is important because especially as women and nurses being mostly women, we really do care for other people so much and we nurture in a different way. And if we don't make time to first start with us, I think that's why we see a lot of caregivers and nurses that are quickly burnt out, very easily agitated, speaking harshly on the job. And again, you wonder, why are you here? But it's not that they don't love nursing, but I think it's because they haven't been taking care of themselves or they haven't felt cared for. And they are tired. We are human beings, we're not robots. And I would say part of my transition into care management was, I was working full time at the hospital and ICU, learning. I was transitioning into the CTICU. Um, and since I had been at that hospital, I really had been go, 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 go. The way our schedules were, yeah, you can get your days off back to back, but I found I was extremely exhausted and I would need at least 2 days just sleeping, just to catch myself. And then I'd be back in the same rhythm. And it wasn't until I got an injury in a car accident and I had to take time off from work that I really began to realize that my body was screaming at me. I am tired. I haven't been to a checkup in 2 years. I haven't done a follow up. I haven't done a pap smear, nothing.
Yeah.
And during that time that I decided, let me just get some of these appointments done while I'm off, thinking I was going to get back to work. And I got a lot of negative news. And I started going to my checkups and I got diagnosed with chronic conditions. And I realized this is not helpful. How can I show up every day and give my all till I'm exhausted and not be able to take care of myself? And that's when I realized this has got to stop. And I'm too young for this. And I know that all the nurses I'm working with, they are dragging themselves in every day. And I think
Yes.
self-care also became a big thing during COVID. It was the first time we got a cold lavender, which is if you think
Mhm.
you can't deal with it anymore and you need a minute, you can call a cold lavender and you can get
Yeah.
a quiet room to calm down. And there were meditation rooms and all these different things because I think COVID really exposed the year of self-abuse, I would
Yeah.
say.
Yeah.
We as healthcare professionals were really allowing ourselves to sink into, down to just
Yeah.
working on the night shift and the kitchen is open and you're having this heavy, 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 heavy meal at 2 a.m. But you need that. You need that meal and
You
you're doing
need
it every
that.
day.
Yes.
It's tough. It's tough. You have to take care of yourself.
Yes, 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 yes. And you know what? You talked about COVID opening up the door and making us realize we're not taking care of ourselves because prior to that, I don't know if we actually realized it. We just accepted it as normal.
Yes. You
Um, you know,
suck it up. I've been doing it for 20 years.
yeah, I know. Yeah, suck it up.
But you see that's we're conditioned to think that there's nothing different, there's nothing better. And that's
Yeah,
another motivation behind me starting my own business was if I had the opportunity to be in control, I wouldn't do it like this. I would make sure these people are cared for. I would make sure that they don't have more work than they can handle realistically, because on paper
yes.
it says one thing and then in real life it's another.
It's another, yeah.
Owners have the power and they have the onus to ensure that the environment makes sense, not just for the patients, but for the people providing the care.
Exactly, 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 exactly. And we got to shift our perspective to understand that the
Mhm.
people providing the care really forget the tasks that they're doing because we can all complete a task, but can we all care? Can we all give care? And if there's a difference between completing the task and giving care.
For sure. For sure.
Yeah, yeah. And we got to a point where if we really just complete the task.
That's it. You just do what you have to do and nothing more. Nothing more.
Nothing more, nothing more, nothing more. And in a sense, it's self-preservation, even if we don't realize that's what it is.
Yes, that really is. Because I mean, you're not gonna go back to school after a certain point, right? You people are tired. You're so tired.
You're tired. Yeah, yeah, yeah. And years go by that you don't realize you're tired.
Yes.
Anyway, we're getting down the dark rabbit hole.
Yeah.
Before we go, are there any gems you would like to leave us with?
One of the reasons why I started this business was because I truly believe that the quality of life that our seniors have is highly dependent upon the support systems that they. Not everyone has 10 kids like my grandmother. And
Yeah,
so I think it's important that our seniors are able to stay connected in the community, not just to care, but to actual community, to relationships. And so my business is not just care management, yes, appointments, education, checking in, but it's also providing a sense of support for the patients, for the members. And I also want to provide resources for their families, provide resources for their caregivers, let them know what's available to them in the community. And so I really do try to gain and amass a knowledge of what's working, what's out there. And so I can provide that to our patients. And also at the core of this, it really started out as an idea for a nonprofit, which was to provide the same thing, but just without the cost. And so 10% of the company's input goes towards supporting nonprofit work. And so we're still a startup, we're still a baby, but we have big plans, big ideas, and things we want to really provide for seniors. And so if you have a heart for seniors and you are aware of any resources that you want to make known, please feel free to share them as well.
all right, all right. And you know what? Just so everyone knows, Rishona just said, please feel free to share them. And so her contact information is going to be in the description box so that you can share these things with her. Rishona, thank you so very, very much for this conversation. Truly, I enjoyed it.
Thank you. Thank you, Dale. This was fun. Let's do it again.
All right, it was fun.
Thank you.